Well, good morning, everybody. Jeff Slakey here on the Daybreak Show. I'm happy to have in studio with me Fire Chief for the North Mason Regional Fire Authority, Beau Bakken. Hi, Beau. How you doing?
I'm doing good. Thanks for having me. I
Well,
appreciate it.
of course, it's always nice talking with you. Last time we were together here at the studio, we had a long conversation about kind of what's been going on in the county in regards to public health and the opioid crisis. And last night, I got the invitation to come out to the Alderbrook, where a large group and a wide swath of the community were there on hand to talk in groups at a dinner about public health in the county, and this is something that you have really been focusing on for the last few years. So, for those who may just now being learning about it,
Sure.
tell us a little bit about why you're so involved with this and what the North Mason Regional Fire Authority has been doing, as well as the other stakeholders in the community.
Perfect. Well, getting maybe starting with your last question, why am I involved? Why is the fire authority involved when it comes to public health, different public health issues? Is if you look at what we're really good at on the fire side, and of course in the fire department we do EMS, we do fire. One of the things we do really really well on the fire side is to prevent us from doing our work. We want to put out fires. We want to not have to go to somebody's house on a bad day when there is a fire. So we work on smoke detector programs. We work with kids, and really what we're doing is trying to work upstream of those emergency incidents. And so I see a niche where we're really good at that, but are we just as good doing similar things on the EMS side and on the emergency medical side? And so a lot of times, when we talk about public health, we think about things like smoking and obesity, the opioid issue, behavioral health, and in the fire authority, we're really called to respond to late stages of a lot of those situations. And so one of the things that I'd like to pride ourselves on is getting upstream of those and how to, instead of just saying, well, our only role is to necessarily respond, which we did in the fire service for years. Our only job, we just go to fires when somebody calls 911. That's it, end
Yeah.
of story. But how do we get upstream and similar to the prevention work and that we're doing on the fire side, how do we do some of that and get ahead of things on the EMS side?
And I know that over the last many years, as the health insurance and health conversations have changed, you guys have been called more and more when it comes to these types of issues.
Absolutely. And so, when you look at our role in a community, and especially in a rural community, access to healthcare is a really difficult proposition. There's
Uh-huh.
not a doctor on every corner. There's not an urgent care on every corner, and doesn't mean that healthcare in situation or health situations aren't in Mason County. They certainly are, and a lot of times, people, because that lack of access is there, the only known access is 911, and we totally understand that. And so, yes, we are doing a lot of emergent work, and that's what we've been doing for years and years and years. There's also a lot of non-emergent work that we're doing as well. And one of the things that you're seeing fire authorities and fire districts and fire agencies getting into is really the non-emergency realm and looking at community paramedic programs and talking about programs, getting back to a model that is not new, but the doctor makes house calls, and where, instead of taking people when they're sick and not feeling well and yarding them into an emergency room or a prompt care center or urgent care center, how do we get it to where the provider responds to you? And you're seeing that with some programs across the state and across the nation, and I'd like to see that here in Mason County as well.
You're working closely with not only the county public health, but also hospital districts 1, hospital districts 2, law enforcement and the sheriff's office, as well as coming down here throughout and working with Chief Moody and the Shelton Police. You've got Peninsula Community Health Services, who's now recently been into the county. So you've got a lot of folks who are interested in helping to fix as best they can this problem here in the county. Now, last night we talked about some pretty interesting and eye-opening numbers when it came to different types of not only the top 5 deaths in the county and those types of backgrounds, but then how depression factors in and the smoking rates with teens and then the vaping conversation. So you've got a lot of folks that are invested in this, and it seems over the last couple of months and maybe the last year or so, you've been able to get folks to buy into this, that not only is Mason County, like you were saying, not a woe is me county, not just a rural Mason County kind
Yeah.
of issue, but also helping folks understand that everybody has a particular role to play, so there's not a lot of duplication of efforts these days, and people are able to really focus in and work on specifics.
Well, Jeff, you weren't supposed to give away the secret in the sauce, and you just did.
Uh-oh.
What I mean by that is, I know it sounds super cliche, but working together. When you talked about and let out with these entities that are getting together and working together, and if we kind of go back to where I first really got involved on some of these issues with the opioid work, and what I saw was, and yes, you got my cackles up when you say, and I hear people say this. You didn't say it, but you've heard this as well. Is we sometimes take a mentality that we're just a little Mason County.
Sure.
There's nothing we can do.
Yeah.
And so I kind of had that in the back of my mind when we discussed the opioid issue. But as we were initially getting away, what I noticed that there's a lot of people that are either impacted or invested or working on the problem already. But the issue is that everybody's doing it in silos and nobody's talking with one another. And so I'm sitting there just shaking my head going, there's no way we're going to be successful. Jeff can only do so much. Beau can only do so much. Other entities only can do so much. There's got to be a synergy there if we're going to be successful. And so when I look at the public health issues that we were addressing last night, same thing. You talk about smoking, you talk about obesity, you talk about mental health and access to care. Those are very complicated, difficult issues that no one or two groups are going to be able to tackle together in our county. And a lot of times we have a tendency to say, when it comes to public health issues, don't we have a department in the county that takes care of that?
Yeah.
Don't we have a hospital that takes care of that for us? We're setting ourselves up for failure if we think that's the case. They're doing their work. They're doing their role. But what we were hoping for last night, and I hope you felt this message come across, is how do we put the public back in public health? How do we get these entities and individuals playing sometimes even a minor role, working together to hopefully push back on some things that are not making our community as enjoyable as we'd like it to be.
Yeah. One thing I noticed was the different groups of folks who were there in the audience listening to this. And as you say, it may just be the ability to pass along a phone number in a networking
100%.
type of thing. You're
100%.
saying, well, actually, I know somebody who is involved now with this program here, and they would be great for you to hook up with so you can further move the football down a little bit if you think about it.
The highlight of my night actually had a little bit to do with public health and not so much. It kind of deviated from that a little bit. And what I mean by that is that I had maybe I can say her name, but Gina from Turning Point.
Sure.
She came up to me and she said, "I just want to thank you for putting together the night. I didn't put it together. It was the Health Coalition that did. But thanks for working through the night." And she goes, "I want to tell you a story of just what happened here towards the end of the meeting." She goes, "I met somebody tonight that I'd never met before, and we're going to be calling tomorrow, and we're going to have a process, and we got a program in play, and it had to do with the nursing issue and whatnot." She goes, "That never would have happened if I wasn't sitting in this room tonight." That is the beauty. So
Yeah.
as much as we're trying to, fill out cards and have a discussion, the secret in the sauce is exactly what Gina was experiencing and relayed to me at the end of the night. And that happens time and time again, but it doesn't happen unless we're working together.
Yeah. Do you think, too, that kind of when it comes back to Mason County, has seen some struggles in the last 10 years or so, and we have had to work together to lift the county up from '08 and the crash and all that stuff to where we're at now in 19, that has helped to kind of remove the us versus them, or hey, we're the hospital and so we're doing this, you're the public health so you're doing that, and it kind of lends itself a little better in our community to work together, to not have those types of us versus them. You were saying that in our county, those 5 entities that we mentioned plus a whole lot more work well together.
Yes.
And that is more of an anomaly
Yes.
than it is the norm
Yep.
across the state government, perhaps even federal government. Do you think it's because we've had to work closer together to kind of lift up the county
Yeah.
that we're able to shed those barriers? Or
Yeah, you hit the nail on the head, and the reason why I say that is because I've been in Mason County for 20 years, and we have done a really good job of working with the model that you just described that doesn't work. Unfortunately, public health issues for and not just public health, but a lot of issues, there is inherent competition. We have different policy ideas, we have different agendas, we have different things we want to work on, we have different approaches that we want to take. All of a sudden those make their way onto the table, and all of a sudden you and I don't want to work together. And there's been a lot of that. There's been a lot of that that's built up over the years. And I think that what has happened here recently is we have realized and proven to ourselves, and especially in a rural community where we are limited on resources, where that's a model that does not work. This infighting and wait a minute, you can't set up shop here because I'm operating over here, that gets us absolutely nowhere. And I think that the change has been that we're going to work together, and all of a sudden, I can't remember the phrase off the top of my head, but rising tide rises
Sure,
all
sure.
boats.
Yeah,
But
yeah.
there's we're experiencing that, and you know what? If competitors, which might have viewed themselves as competitors, years back, hey, if we help one another out and work together, man, we take off. And that has been, and I appreciate you pointing it out, because I wanted to make a strong reference to it last night, is we've got a lot of healthcare agencies and entities and stakeholders that in other counties, they would be at each other's throats, and not for the right reasons. And in Mason County, we are blessed to have some of our key stakeholders that are working on public issues, working hand in hand with one another. We got nowhere to go but up with that arrangement.
It seems I talk to a lot of folks here at the station, and there is, in the folks that I talk to in kind of the decision-making roles around the county, the EDC, the hospital, the county commissioners, the sheriff's office, the police here in Shelton, these are the types of groups and people who acknowledge the kind of north and south divide
Sure.
that is there,
Sure.
but they don't see it in the same sense that I see kind of in the general population. There is a lot of conversation about things in Shelton, things in Belfair, perhaps, if we're just going to do a north-south type
Sure.
of thing. But when we talk with groups like with the people you have together, or with the county commissioners, or with the EDC, there seems to be, over the last, again, year or so, a real acknowledgement that is a stigma that's out there, but it's not the reality. The county is Mason County.
Absolutely.
And it's nice that kind of the mains, and whether or not it's starting to trickle down into kind of just general conversation, but people are recognizing that perhaps at one time there was a little bit of a county divide, but that has needed to go away.
Yeah.
Or else, who knows what could happen. The county could be in a wholly different situation than it is now.
Well, 100% spot on. Again, we have felt a divide for many, many years up in North Mason. Obviously, with the city of Shelton being your county center and seat of government, there's times where we feel a bit isolated, and I don't think it's bad on anybody's part trying to do that. It's simple geography. We're 45 minutes to the north.
Sure.
We're closer in some regards to Kitsap County and Bremerton than we are to Shelton, and sometimes we feel like we're tweeners, kind of in between these two metropolitan areas.
Yeah.
And so, but what you're saying is 100% spot on, where that is eliminating and going away. The geography isn't changing, but the problems that are in Shelton are the same in Belfair. And the people that are working on those issues are the same in Belfair as they are in Shelton. And to see folks come together and realize that, listen, instead of sitting there and working against one another, and I've seen that in the past, again, we get nowhere when we do that. But how do we come together and again, hopefully rise all boats? And one of the things, maybe I'm putting in a plug here, and I don't know if I'm going to get in trouble, but
we'll see. We'll find out.
Well, we're going to find out. But Consejo,
Yeah.
Consejo has been working down here in Shelton and doing some phenomenal work down here in Shelton. And I've been, kind of chomping at the bit to have a similar type of service provision up in North Mason. It's something we have not had as long as I've been up there.
Yeah.
Mental health services. Well, guess what we're doing this afternoon? 3 o'clock, Consejo is going to be opening up, and all of a sudden expanding to all of Mason, or a good portion of Mason County. So we have never worked closer and better north and south than I think we are right now.
Beau Bakken is the fire chief for North Mason Regional Fire Authority. I know we have other things to talk about, but we're going to leave it here right now on that one. And more to come from the partnerships from public health, as well as the hospital districts and the fire departments all throughout the county. Things are only continuing to look up, and you've been, I know you wouldn't say it yourself that you're kind of the spearhead to this whole thing, but
no, there's good people doing a lot more than I am.
But you're definitely one of the main faces of this push to help the health of the county. So we appreciate that for sure. Beau, good to see you.
Same here, Jeff. Thank you for having me.